Um, Dr. Wheeler talked about, going to different situations and having to present, this or that in order to succeed in that setting. Well, ethnic minorities have been doing that for a long time. We learn where we can be ethnic and where we have to tone it down, because if we don't, that may get us carted off. So, minorities know when they can be this identity or that identity. But the important thing for the men is to feel comfortable with whatever identity they have. One of the things that we talk about disclosure. We never ask these men at the end of the session, you have to disclose. You have to disclose your HIV status. You have to disclose your sexuality. No, it's about feeling comfortable with themselves. So they could be whatever they want. They can call themselves whatever they want. It's about them feeling comfortable with what they're calling themselves. I'm not sure that answered your question. It's very, that whole sexual abuse and identity is something that has been a challenge for researchers for a long time.
Hello? Okay, it's on. Well, basically you just answered my question, because that's exactly what I was gonna ask, was how you even define the non-gay identified, because a lot of those narratives could have been very gay identified. And I know initially you talked about people didn't go to certain, not going to West Hollywood, so does that mean that these were men that might be in Leimert Park or something like that? And also if they talked about how did their partners identify, so were these non-gay identified men, being with gay identified men. So it's interesting that you talk about how even that identity could have shifted. So then I go back to then sort of the whole title then of this being about non-gay identified men. What does that say then if you had people changing what was even their identity once the study started, in terms of, because I do feel like this is very much needed information about how to work with non-gay identified men.
Yeah, the issue of sexual identity, I know this makes a lot of people uncomfortable, even the bisexual label. One of the things that we see in the gay community, and many times gay men will say, oh, come on, you're gay. Stop trying to pretend like you're bisexual and with women. We see this all the time. There is this discomfort with the idea of being bisexual. There is this discomfort with our sexual identities changing over time, and that there being a fluidity. Men who have been in a married relationship for years, the marriage ends. They're now in a long-term relationship with a man. That changes, and they go back to being a woman. This is very unsettling for a lot of people. When we talk about the label, the identity label, I just want to say that for many of us, we would say, okay, so they don't identify as gay, but they're calling themselves same-gender loving or homosexual or queer. Well, isn't that the same as gay? For black men, it is not, because when we start talking about the gay label, again, what immediately comes to their mind is the white gay community, the West Hollywood, which for them is very different. So even though the act of having sex with another man may be the same, the culture of the community is very different. And so me identifying with a gay label, gay, versus being homosexual, and we see this with many of our older black men, they're comfortable being called homosexual, but not gay. So the issue of language is challenging, and how it changes over time, and as briefly as over a 4-hour period.
Good afternoon. Just had a question and a comment, really. I'm a nurse practitioner back in New York State, and I work for the county, Monroe County, in their STD clinic. And some of the big issues that I've noticed, even as a young practitioner too, in terms of asking my patients the age of their partners. And one big issue for me is when I have a 20 or 18-year-old who say, well, my partner is 44 years old, and sometimes not knowing what to do with that information. For example, having a patient who is even 17 and their partner is much older than them. And I think in New York State, 17, I think, is the age of consent, and so there's not much you can do there. So my issue is after asking the age of the partner and realizing this discordance, as a practitioner, what do you do with that information? That's the first thing. And the second piece is practitioners most often don't ask those questions because they're afraid of what to do next,
Sure.
which is the reality of it. To talk about the craftiness of some of my patients' partners, if they're known to us in the STD clinic or in the county, in the health department, they'll often, when their younger partners come in for testing and treatment, they'll tell them, don't tell them my name, because I'm known to them, and don't tell them my age. And so then these young folks come in, and they're naming partners who are their age, but they're not necessarily their partners. And the harsh reality is, if you come in with gonorrhea, I need to treat your partner, but because you're lying about your partners, I can't get them in for testing.
Yeah, those are real life challenges. As healthcare practitioners, you know, you're obligated by law to report when you know that a minor is being, it's essentially statutory rape. So there are legal issues. And you as a practitioner need to make sure that you are doing what you're supposed to be doing, otherwise you will not be a practitioner anymore. So that's the first thing. The second is, you know, we have to really understand the relationship. So when, like in this case where we had the mean age being 17, and these young boys having relationships with older men, we really need to understand that context, and we need to talk to these men about it. I keep saying that this is sexual abuse. It is. These teens biologically are children. When we talk about development and the brain, we are talking about the brain of a child that is still developing. There is a lot of plasticity to that brain. This is a brain of a child, not an adult. And many people want to say, no, that's an adult, and it's wrong. That is a child's brain. It has a lot more to grow. The challenge of getting people to disclose, and you're right, we have to treat the partner. It is challenging. I think at the end of the day, one of the important things is to get the partner to come in. And if that your patient doesn't tell you who his partner is, that partner needs to come in on his own, not disconnected. I mean, that's at the minimum. I always talk about this one example. My first study that I did was looking at sexual risk behaviors of resident physicians versus graduate students. And the idea was that, you know, we would expect people who have more medical knowledge and clinical exposure to have lower risk behaviors than those that didn't. And of course the study, no difference. Everyone's doing the same thing. But, yeah, we're all doing the same thing. But the IRB, the Institutional Review Board, made me go to each department and ask the department heads if I could provide an anonymous survey to the resident physicians. And it was very interesting. The study included several universities, so I won't disclose, but the department chair was from the Department of OBGYN. And he was very excited initially, and he said, fax over the survey. So I faxed over the survey. This is 1999 now. I faxed over the survey. He calls me back, and he says, oh, Dr. Williams, we can't ask our residents this. And I said, why not? And he goes, well, your survey starts off as Mary had a little lamb, and then it turned into Mary's doing the little lamb. And I said to him, oh, come on. You know, you're an OBGYN. Aren't you asking your patients this? Well, some of these questions I am. And I remember going back to Gail, Dr. Y, and saying, can you believe, because, again, her husband's an OBGYN, so it's a little bit more intimate. So I said, Gail, so-and-so isn't, you know, going to let me do this because he's, you know. So it kind of shows you even the discomfort that OBGYN, which focuses on sex, this clinician, the department head, was uncomfortable with asking the questions. So we have to get comfortable talking about sexuality, and we have to ask those questions. And unfortunately, once the can of worms is open, you have to do the next thing.
My question is really very specific and can be answered quickly. I was just curious, given the criteria that you use for recruiting people, the eligibility criteria, how did you recruit these men, these guys?
Specifically about the sexual abuse?
Just getting your sample.
So we used a flyer, and it was promoted as a sexual health intervention for men, black men with early sexual experiences. So they had a little idea that it was about early sexual experiences. And then we had a screener. When the men called in, we asked, just like with everything else, age, blah, blah, blah. And then for the sexual abuse items, we asked about specific behaviors. Before the age of 18, did any of these things happen? So essentially, we were doing a modified sexual abuse screener. We never used the word, were you sexually abused? So. Hey, David.
Can everyone hear me? Okay. I just wanted to congratulate you on the work. I think it's wonderful work, first of all. And then the second point I wanted to make is that we're talking a lot about black MSM and MSM in general. I just want to throw out there that we did a qualitative study with 90 predominantly heterosexual brothers in Georgia, and there was a large number who reported being sexually abused as well. So I think we have to be careful to just say this is a dynamic because of that interpretation that you were talking about, where people, instead of just saying there's an association, they're implying or they're inferring causality with this whole notion, because I don't think it's necessarily one leads to the other. It is happening a lot, and then we also have to be careful to make sure that this is not just a black thing. This is something that's actually...
Because it focused on black bisexual men who are positive, and what David said, the issue about child sexual abuse, CSA has been studied in many other populations, but when you start looking in the literature and trying to find black boys or black men, you start having to do a really hard search. So, does this exist? Oprah's special with Tyler Perry and all the men that came out, that was a powerful episode. I think it did a great job in that it opened a lot of people's eyes to, wow, this does exist in the black community. Not to pathologize the black community, but to know that we need to know that this is an issue, and that we need to understand how this experience affects who we are today, because the past does affect who you are. So, thank you. I'm going to ask the panelists for our next panel to come up.